Dr. Ferguson, who is at risk for breast cancer? Just a family history, age, you know?
So those are some of the risk factors that are more well known if it's in your family. Increases with age.
Okay.
Things that women may be less aware of, lifestyle factors that they can, think about early on, would certainly include smoking,
Okay.
stress reduction. Stress reduction plays into our hormone production and inflammation in our body. So, learning how to handle stress well is a big part of life, and certainly contributes to cancer prevention. Other things that contribute are decreasing inflammation. Inflammation causes cellular changes, and some of those changes can lead to cancer. So things that contribute to a low inflammatory lifestyle would include eating a lower glycemic index diet, avoiding sugars and highly processed foods, artificial sweeteners, colors,
Okay. Bad fats.
preservative agents. Yep. Taking in, getting healthy fats, so the omega-3 fatty acids, eating healthier fats versus bad fats. Other things that can contribute to inflammation, our toxic lifestyle, so our toxic world. Trying to limit our exposure as much as possible. And that can be very hard because we don't have a lot of control over the air outside our homes. We do have control over the air inside our homes. So keeping your home as chemical free as possible, trying to well ventilate your home whenever you're using chemicals, if there's any remodeling going on, if you're, when you bring your dry cleaning home, leaving it outside a couple days, let it off gas all those chemicals. If you're putting down any kind of finishings, products on your wood or carpeting, all those things create a lot of off-gassing. So filtering your air for chemicals, well ventilating, trying to avoid scents in our soaps, and our artificial scents in our soaps and our lotions and our cosmetic products.
And our laundry detergent.
And our laundry detergent. So, trying to be as natural as possible in the home care products that we use. Also can decrease inflammation and toxicity and ultimately, lessen our risk for cancer that much more.
Are mammograms safe? Should we be getting one every year?
Currently, that's what is recommended.
After a certain age, of course.
After
40?
Okay. So after age 40, mammograms are now recommended once a year. The exposure to the radiation from a mammogram at this time is judged to be less of a concern than missing cancer in the first place. I wish that I had a better answer than that for you.
Okay.
Some women choose to go to use other means of screening their